Eating mice to celebrate the birth of a new baby. Two guys man up and try to go through what you women always go through, labor pain. But first, some women, ta-da-da, drum roll guys, some women actually experience an orgasm during the birthing process. This is the real Nurses Talk Show. Let's get started. Toia. Just wave to them.
Oh, hi.
Hi. All right, you go ahead. I'll let you just want to sit down, okay? So we're here today with Toia. Toia, how are you?
I'm fine, thank you.
I'm so glad you were able to make it to the Real Nurses Talk Show.
Thank you for inviting me.
Oh, you're very welcome. And Toia, where do you work?
I work at OHSU in the Labor and Delivery Unit.
Okay, how long have you been there?
I have been there for 10 years.
Oh wow, that's a long time, isn't it?
It's a long time.
Yeah. Were you working someplace else before you went to this unit?
I worked in labor and delivery in Phoenix, Arizona at the county hospital there. And then before I was a labor nurse, I worked in a subacute facility with patients who had recently been discharged from the hospital.
Oh wow. I bet you've seen a lot of births.
I have seen a lot of births. I stopped counting somewhere around 500.
Oh my goodness, people. Wow. So I was wondering, what made you decide to become a nurse? Have you always wanted to be a nurse?
You know, I was present for my sister's birth when I was 8.5 years old. I got to watch her be born, which was a pretty unique experience for an 8-year-old.
Oh my goodness.
And that's when I first had an interest in birth. And I think sometime in high school I decided I wanted to be a nurse. I went to nursing school right out of high school.
Oh, that's pretty good. So while you work, do you have to rotate your schedule? Because the L&D is not like your typical nursing unit, right? You have different factors to it. Do you want to share with the audience?
So we don't really rotate schedules. We have day shift and night shift. I've been there long enough that I'm on the day shift. It's seniority based.
Okay.
But we do have to take mandatory call because the number of women in labor is so unpredictable.
Right.
So we schedule a certain number of nurses, and we can have fewer nurses if we need fewer. But if we need more, we use our mandatory call system. So we take 8 hours a month or 8 hours every 4 weeks of mandatory call.
Oh my. And mandatory call, you mentioned if they come in the bed. So I'm assuming that sometimes when they come in, they are in a regular unit, and sometimes they give birth there, and sometimes you have to go to the OR. Do you have your OR right there on the unit?
We have an OR right on our unit. Yeah, we have 3 operating rooms available.
Okay, cool, cool. So what role does the nurse usually play in assuring that delivery is safe and uncomplicated? Nurses
have a really big role in keeping birth safe. We are the people who are with a patient in labor and watching the fetal heart tracing and communicating that to the physician. Physicians may or may not be in the hospital or in the labor and delivery unit. So the labor nurse is keeping track of not just the mom's well-being, but also the baby's well-being all through labor. And then there are things we do to take precautions at birth based on risk factors. So if we know a mom has certain risk factors, we may prepare differently than we would for other moms.
So what do you mean, risk factors?
If a baby's particularly large, there's a risk that the shoulder could get stuck when the baby's born. So we do things like have stools available so that we can get up, and there are some maneuvers we do to help those babies out. And so if we have a suspicion that that's going to happen, we prepare that way. A mom who's had a hemorrhage.
So do you want to show me? When you said stool, where do you place the stool?
So you place stools on either side of the bed, and you would have 2 nurses there for that birth. We try to have 2 nurses for all our births. And then the maneuver is actually, we'd have to have a patient who is up in stirrups, but the the legs go way back.
I don't think I want to do that.
No, you don't. But anyway, those are some of the things we prepare for. A mama who has had bleeding or a hemorrhage after birth, in a previous pregnancy, we would have certain medications available because we would know that she's at higher risk to bleed. So there are multiple things like that.
So I am assuming that a lot of mothers plan their births in advance. And so what's the birthing plan? I'm assuming
a birthing plan.
Yeah,
What's a birthing plan?
yeah.
I think that a lot of people think about their birth all through their pregnancy. They think what their birth experience will be like.
Right.
And so people have an idea in their head about what they want for their birth. Some people will just communicate that to you verbally, and other people write it out and will have what they call a birthing plan that says specifically, these are the things I really want to have happen, and these are the things I don't want to have happen.
Right.
And I don't think it's really, there are not a huge benefit either way to verbally communicating it or having it on paper. I think as long as your support person knows what you want and can be your advocate if you're unable to tell me yourself. Some patients get to a place in their labor where they're not able to say what they want really clearly.
Is it because of the pain? Or
Because they're coping with the labor, yeah.
Got it.
The nice thing about a birth plan on paper is that we can go through that at the beginning of the labor process, and I can read it as the nurse and say, these things sound really reasonable. Because people will say, I don't want this specific intervention.
Like what?
Like I don't want any fetal monitoring.
Got it.
Well, we always do some monitoring of the baby, but we don't have to do continuous fetal monitoring always, depending on risk factors. And so I can say to a patient, these are the circumstances in which we would need to do this.
Right.
And we can talk about it beforehand so it's less stressful than in the moment.
So why would someone decide that they don't want their baby to be monitored? Is it because they want to be more ambulatory?
Some people want to be more ambulatory.
When you walk around.
Yeah, we have some cordless monitors that we can utilize for that.
Okay.
Some people just want more freedom because even if you're on the cordless monitors, there are certain positions that you can't sit in. So if you lean back in this way, the fetal monitor just doesn't pick up well because it's angle-based. So people will say, can I have intermittent monitoring? And for a healthy mom without complications, we can often do that where we monitor the baby every half hour or every 15 minutes, depending on the stage of labor.
So is there a specific period in the labor that you actually have people come into the hospital say, okay, now you can come to the unit?
We generally tell people to come in when their contractions are every 5 minutes for at least an hour and painful. That doesn't mean
painful?
People will have contractions that aren't painful. So sometimes in early labor, they'll notice the tightening of contractions, but they're not really painful.
Got it.
And those are not generally true labor. You'll every once in a while talk to a woman who tells you she had a painless labor, but that's definitely the exception, not the rule. So
that's what I would want.
You're going to sign up for that?
I'm going to sign up for that because when we were talking earlier, I mentioned that one of my biggest fears is the pain of childbirth. And you were telling me that's not terribly unusual.
No, it's not. It's the unknown. And, I think especially first-time moms just don't know what to expect. Right, and that's the scary thing, the fear of the unknown. And
if you see Hollywood's version of it, it's pretty dramatic.
It is. It's very dramatic, that's true.
And I kept thinking, I want to do that to my body. I mean, I just can just imagine it's like a war zone down there during that period. But then the end result is so beautiful, isn't it?
It is a beautiful thing. It's a beautiful thing to see a new baby on a mama's chest and see a partner seeing a baby for a first time, and it's a beautiful thing.
So have you ever had someone share with you a very unusual birthing plan?
Some of our patients, I think that some of our patients just have very specific birthing plans, medications they don't want, interventions they don't want, and we certainly try to honor that. But I think the thing that sometimes people don't keep in mind about birth is that it's an unpredictable process. And the interventions we use, may have been overused at one point in time. Whenever a tool is new, people want to use it. But I think we're much better now at not using things unless we need them. I think of those interventions as the things I have in my toolbox, and I don't pull them out if I don't need them. A normal, healthy mom with a normal labor may not even need to open that toolbox.
Okay.
But sometimes.
So what kinds of stuff do you have in your toolbox?
Well, I mean, it's a figurative toolbox.
I know.
But, people will
I'm
say,
liking the idea of a toolbox.
Idea.
Let's take out a hammer.
People will say, I don't want to have my membranes artificially ruptured. Because oftentimes contractions are much more painful after the membranes are ruptured. Also, once the membranes are ruptured, there's more risk of infection
Right.
after a
So
lot of
they
time
would
passes.
want it
So
to
people will
happen
say,
naturally.
right.
Right.
But there are times when we might need to know what the fluid, what color the fluid is, the amniotic fluid. Or there are times when labor stalls out, when rupturing the membranes is a way to make labor happen without using medications. That's not a nurse's choice, that's a physician or a midwife's choice, but there are all these things that we can help our patients understand, that sometimes you may think you don't want something, but sometimes it's better than the alternative.
That is true.
So I think that the birth plans that worry me are the ones that say I absolutely only want this ever, because that's really hard for a patient if things don't go exactly according to plan.
And then they don't have, then it adds to the stress of the...
It adds to their stress, exactly.
Right.
Although the nice thing about them bringing in a plan like that is that it does give us the opportunity to talk to it about it at the beginning.
That is true.
Whereas if a person has those expectations and doesn't share them on paper, we may not have that discussion. So there's pluses and minuses.
Yeah. And you know, we did talk about me getting pregnant on stage. So we're going to try to stimulate that for people. And the reason being, you want to demonstrate some of the challenges that women experience as they get towards, you know, a more advanced in their pregnancy, correct?
Right.
And before we do that, while I'm getting pregnant, oh, he has my belly right there. Thank you, Tassilona. Thank you. So it is a pillow. You can all see that. You're going to help me get...
Okay.
All right. So there's a little change of plans here, folks. So.
You don't really look like you have a full-term baby in there. Now I have to treat you for preterm labor.
You do? Oh no. So yeah, so that's pretty much, it's not full-time. Don't people have smaller pregnancies too?
Yeah, I would worry that you haven't been having good nutrition in this pregnancy if you were term and this was the size of your baby.
Oh my. So what kind of things did we want to go through and demonstrate?
So as you get further along in your pregnancy, women will feel uncomfortable walking as that baby moves down into the pelvis.
Okay.
So walking, women will describe that they feel like they waddle.
Okay, like kind of like that?
Kind of like that, yeah.
Okay.
And so walking becomes uncomfortable. We often tell people to walk more, even though it's uncomfortable.
Even though it's uncomfortable.
Yeah, because the more you sit.
I bet it's pressing against the bladder too, huh?
If the baby presses against the bladder, and women really experience frequent urination, and that can be frustrating.
You're not going to make me urinate on stage, are you?
No, I won't. I don't think we have a bathroom here.
Okay, good. So frequent urination, anything else that they experience?
Some women have difficulty laying flat in the bed.
Oh, so if I was going to lay down?
If you were going to lay down, we would have you lay on your side.
Out like this?
Yes, not just for your comfort. One, for comfort because the baby pushes on the lung space, but also because the large vein, the vena cava that returns blood to the heart, becomes compressed by the uterus.
Okay.
So that uterus is so large and heavy that if you're laying flat, it compresses that and decreases the blood circulation to your heart and then to the placenta.
So it compresses the placenta and that's hard for the
vena
baby.
cava, which returns blood to the heart, which then feeds the placenta. So we encourage people to lay on their side instead of on their back as they get further along.
I can tell right now that, oh my God, bending down is going to be a nightmare.
Bending or over gets very difficult. So
my goodness.
You can bend from your knees, and you might find that
like kind of like that.
Squatting. You might find that easier because you're over.
Okay. Yeah, that's pretty cool. Well, I think we might want to get the baby out of here.
Well, Before you give birth to this pillow, we should talk about exercising and whether or not you continue your exercise regimen.
Okay.
So, you know, we encourage women to exercise when they're pregnant at their pre-pregnancy level of fitness.
Okay.
So if you've been a runner, you can continue to run through your pregnancy unless your doctor tells you not to.
Okay.
But don't take up running at this point in your pregnancy.
Oh, so when I get, if I've never done it, this is not the time to run and to go do a marathon and try.
That's right.
Not the right thing to do. And are there things that you think we shouldn't eat during pregnancy?
You know, they tell people to stay away from shellfish because of the mercury in shellfish.
Okay.
Soft cheeses have some bacteria or have the the chance of having bacteria. They say no lunch meat, also because of the bacteria that's possible to be there. Your doctor would counsel you specifically, but those are the things that come to mind.
Okay, or your nurse midwife?
Or your nurse midwife, absolutely. Absolutely.
Yeah. So if I was experiencing labor, are there specific foods that you want us to eat while?
When you're in labor, when you're in early labor, some people are hungry and are able to eat, and I tell people not to eat anything they don't want to see again. Okay. So that's different for everyone.
Don't eat anything you don't want to see again.
Unfortunately, we are talking about throwing up, yes. So labor can often make people vomit, and so light meals are good in early labor. When things progress more, we may ask people to have clear liquids, depending on what's happening. Some people are able to eat all through labor. Mostly you kind of lose the desire to eat as labor progresses. Yeah.
Okay. So it's not like, if you have any kind of restrictions during that period of time, it would be primarily related to the medical conditions or complications that are associated with it then?
Correct.
Yeah. You know, I had a friend that she got pregnant and she decided that she was not going to have any kind of tea or green tea. Is there any validity to
I think
that?
a lot of people decrease their caffeine intake. I know green tea has a lot of caffeine. I think a lot of people decrease their caffeine intake or eliminate caffeine during pregnancy.
Okay.
And I think that there's research that says that that's good, and I think there's also research that says moderate amounts of caffeine are probably okay.
This must be like this must be like something that pregnant women do all the time, because I find myself putting my hand here like the entire
You can't stop, can you?
It's so weird. Oh my goodness. So if I was experiencing labor, the contractions usually start in certain areas, or is it different for
some
everybody?
people feel their contractions more in their back, depending on the position of the baby. Other people feel them across the lower part of the abdomen. Some people feel the whole belly squeezing. Okay. So it really sort of depends on your body and where your baby is positioned.
Okay. So if I was going to try to sit down, this is bizarre. So pretty much like that? Is that what you recommend?
I think if you can get into the chair without falling, that's probably safe.
Okay. So I would like to.
You would like to give birth to this baby?
Please.
Okay. Sign up for an induction. You need to be at least 38 weeks before we induce that baby.
Okay. So, you know, it's interesting to me that Lala mentioned inducing the baby. There are certain cultures. I was just reading, like in Brazil, women, there are more and more elective cesareans that are being done. And is that common practice here in the United States too?
There are parts of the U.S. where elective cesareans are more common. I think here in Oregon they're not very common. They're fairly unusual. I know that in Brazil they're very, very common.
Yeah, I found that very interesting that women would opt for that. And then I think the other thing I was reading was like in Turkey, because they have such a limited number of anesthesiologists. Women don't want to go through, you know, the pain of labor, so they're actually opting to go on the general anesthesia
for their births.
For their births, and have
wow.
to see. It's not something
that is really interesting.
I thought it was. So, what would I do when I come to the hospital and I say, you know, I am experiencing contractions? They're a minute apart.
Okay, so when you would come to the hospital, we would get you into a comfortable position in bed, and we would take your vital signs, make sure your blood pressure is okay, make sure you don't have a fever. The other thing we would have done was have you pee in a cup when you came in, because we want to check your urine for protein.
Got it. And what are you looking for when you check for that protein?
As pregnancy progresses, some women will develop preeclampsia, and that one of the manifestations of that is protein in the urine. Okay. And we also look at a few other things, but that's kind of the most common thing we're looking for.
And preeclampsia too.
Preeclampsia is one of the complications that can happen in pregnancy that is high blood pressure, protein in the urine, and the risk with preeclampsia is seizure. Right. So there are medications we give to decrease the chance of seizing, and really the treatment for preeclampsia is delivering the baby. Right. So in general, we would induce someone with preeclampsia unless they're very preterm. Then sometimes we would monitor them closely and try to get the baby a little further along. Obviously, that's a physician or midwife decision, not a nurse decision, but we help take care of it.
And we were talking about, you get them in a comfortable position, you've done the vitals, they've already peed in the cup, and what happens next?
So then we would put the fetal monitor on and make sure that the baby's tolerating everything. So the monitor, we have two, I wish I had brought my monitor part. They're kind of about this big and with cords, and so we would put one on and listen to the baby's heartbeat. And then we have belts. We have two options. We have belts, or we have it's like a tube top for your belly, a belly band that hold those monitors on.
Got it.
So one goes on the baby and the other goes toward the top of the uterus, or what we call the fundus of the uterus. So we can measure the contractions, and it actually just looks like little hills when there's a contraction. So it helps us measure how frequent the contractions are, which we can also measure by sitting with a woman, right? If we sit with you, we can tell when your contraction is when they are. So we measure from the beginning of one to the beginning of the next to see how close together they are. The other thing we're looking at is how is that baby responding to the contractions. A healthy baby with a healthy placenta usually doesn't respond to the contractions, just looks fine. If the baby's heart rate is changing in response to the contractions, then that would be something we would contact their care provider. Or that there's something, not necessarily distress, but it was something that it would be something we would alert the doctor or nurse midwife about, so that we could further assess it.
So we have put on the fetal monitoring on the mother to be right now. Mine being a pillow. Then what happens? And
then we like to get about 20 minutes of tracing of the baby, unless something tells us we need to do something sooner. Then someone would examine your cervix, which is something people are not always prepared for. Yeah, I don't think we have to do that on TV either.
Yeah, I don't think we want to do that.
So that is the real assessment, to see how far dilated the cervix is. And sometimes one exam isn't enough to tell us, because there are some cervical exams, for example, for a first baby, if you were 2 to 3 centimeters, you could be in early labor, or you might not be. So in that case, somebody with a first baby at 2 to 3 centimeters, we would often say, go walk for an hour, come back, and we'll re-examine you. Because true labor is contractions that change the cervix. You know, unfortunately for some women, they may have strong contractions every 2 to 3 minutes for hours on end that aren't changing the cervix.
It's not changing the cervix. So when do we decide, okay, enough already, the cervix is not changing?
Well, when we induce labor, you know, when we augment or induce labor and someone's not in labor, we really increase their risk of C-section and of other complications. So we try not to keep people who aren't in labor unless there's a good indication. The things we would tell people to do are drink lots of water, because if you're a little bit dehydrated, the uterus will contract more. Warm showers or baths can be very comforting. A warm bath sometimes.
Do we have access to that while we're in the hospital with you?
In our labor rooms, we do have bathtubs for comfort. A patient who came back from walking in hadn't changed, we would probably advise them to go home, because you're more comfortable in your own home.
Got it.
But we do have that option. We do have tubs for comfort for early labor, or some people will labor in the tub throughout their labor. But we would say warm showers, warm baths, sometimes will slow down those contractions. Good hydration, back rubs from your partner, things like that can be comforting. Sometimes trying to get some sleep. Sometimes the excitement of having the baby and being in labor makes it feel like you can't sleep through them, but sometimes just getting a nap, people will wake up and be in active labor.
Oh, that's pretty cool. Two things I found that is very, very interesting, because we're trying to figure out like what the birthing customs were around the world, you know, and how it compares to what we do here in the United States. But in Europe particularly, a lot of women who are pregnant are actually encouraged to go see a nurse midwives. They don't even see the obstetrician at all unless there is a complication. Right. And I thought that was very interesting. Because people don't realize just how independent that practice is.
Yeah, and we have a flourishing nurse midwife practice at OHSU. And I love working with our nurse midwives. They're fantastic. And I think they can provide wonderful care for young, healthy, not even young, but healthy, because we are, as women, having babies older. I know I did. But for the healthy, uncomplicated pregnancy, I think it's fantastic.
Yeah, and there's a video we're going to be showing you guys of these two guys, two Dutch guys who decided that, you know, women can't have all the fun. So they are going to try to go through labor and see what the deal is. Apparently they didn't believe all the millions of women who've been complaining that, you know, labor actually does hurt. So they went through this. We're going to cut to the video. We'll show you that, okay? It's very interesting.
Oké, nou, adem. Je spant helemaal samen. Goed zo, goed zo. Dit is het. Probeer dit eens door te zetten. Door te zetten.
Oh, Dennis. Oh, jeetje.
Even doorzetten.
Nee, het lijkt op lachen, maar het is het niet.
Oké.
Oh, hij komt, hij komt.
Rustig.
Ja, rustig.
Blazen. Rustig in en uit door het masker.
Oh, dit klinkt thuis ook.
Ja, dat hoort fijn.
The drum roll, guys. Some women actually experience an orgasm during the birthing process. Who would have known? Trading labor pain for an orgasm? Doesn't that sound like something you'd want to do?
Some mothers have discovered the secret of turning one of the most painful things imaginable into one of the most pleasurable.
This is Amber Hartnell's labor, and the look on her face says it all. She joins a growing group of women who say instead of agony, childbirth could be ecstasy. Amber actually had an orgasm while giving birth.
All of a sudden the orgasm just started rolling through, and it just kept coming, and my whole body was spiraling and rolling, and I was laughing and crying, and
you were actually purring.
I was purring.
Hard to imagine? Deborah Pascali-Bonaro, a childbirth educator for 26 years, says the same organs involved in sexual orgasms are being stimulated during childbirth.
How come I've never heard of that before? Is this just a huge, well-kept secret?
It is, as we say, the best-kept secret. I'm only asking that people open up and take a new look into birth.
It's been half an hour already. We'll do one more thing before we wrap up. So, if someone was thinking about getting into your specialty, what would you advise them?
I would advise them that they need to be able to work night shift, because young nurses work night shift. Some people can't. I would advise them that you have to love what you do. So I think that the senior practicum that most people do in nursing school now is a perfect opportunity to really see if this job is for you.
That is true. I am so in agreement with that. But I'm being told that we need to wrap up, so it's been a true pleasure having you here.
Thank you so
it
much
went by
for
really
having me.
quickly.
Yes, it did.
After all the waiting you did too.
Congratulations on your baby.
Yay. So until next time, find us on Facebook, find us on YouTube, tweet away. We love it when we talk about us. And this is Only Justice to the World of Bye.